Welcome back. This is Dr. Arnav Raj from MetaHealthX, where clinical excellence meets excellent results. Today, we're going to talk about Hashimoto's thyroiditis and how do we know what stage of autoimmunity that we are in when we have hypothyroid related to Hashimoto's thyroiditis. Now, behind me, we have three phases. Oftentimes, when patients come in, they already know that they have Hashimoto's thyroiditis. They're already in the inflamed state. Their TSH is off, or they've been diagnosed by their physician. Okay, so when we look at patients, we have to look at it in terms of different stages, because if we can catch things early on, the outcome could be much better. So let's look at it. We have stage one, when someone comes in and they have what they call silent autoimmunity, right? What that means is that they have antibodies to their thyroid, they have their TPO and thyroglobulin antibodies that are positive, yet they have no symptoms and they have no loss of thyroid tissue, right? So the labs come back normal, everything's normal except they have an elevation of thyroid antibodies, yet it's silent. Second stage is when they come in, they have autoimmune reactivity. What that means is they have elevated thyroid antibodies, but they have symptoms of hair loss, brittle hair, constipation, cold intolerance, etc., right? They have symptoms, but when they check their TSH, thyroid stimulating hormone is normal. If TSH is normal, in the medical model, there's nothing to do, right? Yet they are experiencing symptoms and they have elevation of their TPO and thyroglobulin and normal tissue loss, right? So that is called autoimmune reactivity. Now what happens is you have autoimmune disease, stage 3. In that stage, you have elevation of TPO and/or thyroglobulin antibodies, you have symptoms, hair loss, constipation, weight gain, etc. You have miserable tissue destruction, right? Your thyroid is inflamed, it's tender to touch, there's destruction happening of the thyroid gland and the elevated TSH, right? Now here we go. TSH is normal, elevated TSH. This is when the conventional medical model will intervene. The TSH is elevated and you need thyroid hormones, right? To bring the TSH down, tissue destruction is already occurring, right? So when patients come in, oftentimes they're kind of in this stage. But what we like to do with those patients is, if they have children or sisters or family or relatives that are close to them, is to say, have them check for TPO antibodies and thyroglobulin antibodies. And the reason is they might have silent autoimmunity going on and they have not reached this stage yet. But a silent autoimmunity, if you can catch it early on in stage 1, there are a lot of lifestyle and nutritional management interventions that can be used to help keep the autoimmunity in the silent stage. As we start to progress, it becomes more difficult. So if someone has elevated TSH, they might have been diagnosed 5-10 years ago. They are on thyroid hormone, thyroid replacement hormone, right? And the tissue destruction continues to happen because this is an autoimmune disease and they have elevation of TPO and thyroglobulin antibodies. So they will never or possibly never get off the thyroid medications, right? But there's also interventions you can do in this third stage, right? So it's very important to decipher where we are in the 3 stages of autoimmunity for Hashimoto's thyroiditis, and make your interventions early on rather than waiting for the TSH to be elevated to be diagnosed or treated, right? My name is Dr. Arnav Raj from MetaHealthX. We'll see you guys next video on the Hashimoto side. Have an awesome day.